Hi and welcome. Today we are going to dive into how nitric oxide can enhance your sleep quality. We know that nitric oxide is critical for so many bodily functions. It's involved in physiological processes such as regulating blood sugar, immune responses, and neural connections. It is our master vasodilator, so it allows blood, nutrients, and oxygen to travel to every part of the body effectively and efficiently. And it is one of our major contributors to homeostatic sleep. Hi, my name is Dr. Arianne Missimer. I'm a functional medicine practitioner, doctor of physical therapy, registered dietitian. I'm a medical educator for Rupa Health, and I'm the owner of the Movement Paradigm Integrative Health Center. And I'm super excited to chat with you today about nitric oxide. So today we're going to give a little overview on nitric oxide. We're going to talk about nitric oxide's role in sleep, some common factors that might affect your patient's nitric oxide levels or yourself, some functional medicine strategies to boost nitric oxide for a better sleep, and we're going to talk about a case study at the end and bring it all together with helping you understand nitric oxide's role in sleep and what you can do for your patients and also what you can do for yourself to really optimize so many bodily functions that are affected by optimal sleep. I always like to start off with a very bold statement, which is sleep is more important than exercise and nutrition combined. If we are not sleeping optimally, then nothing is going to work the way that it should. So whether we are trying to heal, we are trying to help our patients on their own healing journey, whether you are trying to perform optimally in your sport, or you just want to feel great every day, sleep is going to drive everything. And so when I'm working with patients, I always come back to what are the factors that are affecting their sleep patterns? Is it related to chronic stress, autonomic nervous system dysregulation? Is it related to potentially systemic inflammation, mitochondrial issues, hormonal issues? And we really want to understand all of these in addition to, for example, does someone have let's say a sleeping disorder, so upper airway resistance? Are they a mouth breather? Are they snoring? Do they have sleep apnea? All of these factors are going to significantly affect someone's quality of life, and so we have to really be thinking of starting here, and nitric oxide is going to play a critical role in that. We have various nitric oxide pathways. So we have the nitric oxide synthase pathway, which is the pathway that we lose the ability to make nitric oxide as we age. We have the enterosalivary pathway, which is nitrate to nitric oxide, and this happens via the posterior aspect of the tongue where we have anaerobic bacteria. We have the nitrate to nitric oxide pathway, and then we have alternative pathways for nitric oxide, which is actually in the parasinuses. So it is well established that nitric oxide production makes a key contribution in daily homeostatic sleep, including our slow wave deep sleep as well as our REM sleep. So nitric oxide can promote better sleep because it plays a significant role in the regulation of blood flow, as I mentioned. So it's the master vasodilator. So it can also help with improving vascular tone, which is going to enhance sleep quality. The ability of nitric oxide to induce vasodilation or the relaxation of the blood vessels is going to enhance blood flow, oxygen delivery to the body, including the brain. And remember, at night, this is where our brain is detoxifying. So it's extremely important that we're getting adequate blood flow to the brain. This process is crucial for restorative sleep, particularly during the deep sleep stages when the body is undergoing repair and restoration. So as we dive into the literature regarding sleep and nitric oxide, we can see that a study published in the Journal of Sleep Medicine explored the relationship between nitric oxide and sleep regulation. So the researchers found that nitric oxide production during sleep could improve sleep quality by promoting deeper, more restorative sleep phases, as I had just mentioned. The study highlighted the importance of nitric oxide in maintaining optimal blood flow during sleep, and that's the main reason for this, which is crucial for brain oxygenation and overall sleep quality. The next is nitric oxide and sleep disorders. So researchers also examined the role of nitric oxide in sleep disorders such as sleep apnea. So this is something that I am frequently looking at with my patients and work very closely with a local dentist and airway specialist where we're looking at how sleep apnea, upper airway resistance, other airway disorders are influencing their overall health and well-being. And so in patients with obstructive sleep apnea, there's, of course, no surprise, decreased nitric oxide levels, which contribute to impaired blood flow and oxygen delivery during sleep. So the therapeutic strategies were aiming at increasing nitric oxide levels in these patients and have shown to improve sleep quality, reducing the severity of apnea episodes. So we want to look at this from both aspects because the enterosalivary pathway and the parasinus pathway are both going to be influenced by airway. So, for example, if someone is mouth breathing all of the time, then they might have dysbiosis in their oral microbiome. And when we look at the parasinus cavity, if someone's mouth breathing, then they're not optimizing nitric oxide production through that pathway. So it is critical to be able to understand the relationship between any type of airway dysfunction or sleep disorder and how it could be influencing nitric oxide production. And then the last is nitric oxide and melatonin production. So a study published in the Journal of Pineal Research demonstrated that nitric oxide could enhance the synthesis of melatonin, which is a hormone that regulates sleep. The study suggested that nitric oxide donors, substances that release nitric oxide in the body, could be used to improve sleep quality by boosting melatonin production, particularly in individuals with disrupted sleep patterns. So often we see patients, or you might be experiencing this yourself, where you are having very dysregulated sleep. So this is a really good opportunity to look at this correlation of when you feel like you are overdosing on melatonin. We want to begin to ask the question, why is that happening? Why are you not producing enough melatonin to sleep optimally? And this is where we can also begin to link nitric oxide. So what are some common factors that affect nitric oxide levels or the patients that you're working with? Number one is going to be diet and nutrient intake that is lacking in nitrate-rich foods. So this is going to be things like leafy greens, so spinach, arugula, root vegetables such as beets, and also antioxidant deficiency. So antioxidants like vitamin C, different polyphenols, these are going to actually help protect nitric oxide from free radicals. So we want to be thinking of antioxidants reducing oxidative stress, because a diet low in antioxidants can result in decreased nitric oxide levels because it allows for greater degradation of nitric oxide. Also, sedentary lifestyle. So a lack of physical activity can significantly reduce nitric oxide levels. Exercise is going to stimulate the endothelial cells in blood vessels to produce more nitric oxide. So the more sedentary we are, the more we are lacking in this amazing benefit from exercise to produce nitric oxide. So this is going to help to maintain blood flow and vascular health. And so regular physical activity is essential for supporting nitric oxide production. Overtraining, on the flip side, is something that can be excessive training with poor recovery. So that could be anything from just literally overtraining, too many days a week, too much volume, too high intensity, without the proper nutrient support to do that, maybe without the proper sleep to do that. This can lead to increased inflammation, increased oxidative stress on the system, depleting nitric oxide over time. As people age, we decrease the ability to produce nitric oxide. So that is a fact. So we do have to consider that. So the decrease in nitric oxide levels is one of the reasons that older adults are going to be more susceptible to cardiovascular disease and cardiovascular events. So as blood vessels become stiffer and less responsive to vasodilation, these things can happen and become more common. Oxidative stress and free radicals. I've already mentioned this quite a bit, but high levels of free radicals that could be coming from environmental toxins or poor diet, chronic inflammation, can ultimately degrade nitric oxide in the body. So free radicals, which are going to be unstable molecules, they're going to react with nitric oxide and reduce its bioavailability. So ultimately, it diminishes the ability to promote blood flow and relaxation of the blood vessels. Let's not forget smoking and alcohol. So tobacco, once again, is going to introduce free radicals into the body, which are going to significantly reduce nitric oxide production. This can lead to stiffened arteries, impaired blood circulation, and excessive alcohol. While moderate alcohol consumption can have mixed effects, excessive alcohol intake can reduce nitric oxide levels by increasing oxidative stress and damaging blood vessels. Chronic stress. This is something that so many of us are experiencing on a day-to-day basis, and prolonged stress is going to elevate cortisol levels. This can indirectly influence or negatively affect the impact of nitric oxide production. High cortisol levels are going to increase inflammation. They create increased cytokines. There's more oxidative stress on the system. And so ultimately, this can influence the bioavailability and production of nitric oxide. Poor sleep. So I've already mentioned this, and obviously this is the topic of today. But just as we're talking about how nitric oxide can influence sleep, we also want to recognize that poor sleep is going to decrease nitric oxide production. So that can look very different because one person might simply have poor sleep hygiene, where another person might have sleep apnea. And that's on two ends of the spectrum. But any way that we look at this in terms of sleep, quality and quantity, can really influence nitric oxide production. So our body is dependent on restful sleep for recovery and repair, including our endothelial dysfunction or function, So chronic sleep deprivation leads to increased oxidative stress and again, further diminishing our nitric oxide levels. So now let's get into some functional medicine strategies to boost nitric oxide for better sleep. Number one is nutrient optimization. So we want to consider more nitrate containing foods. So I have mentioned some earlier. We also want to consider things like celery, rocket, parsley, leeks, cabbage. All of these can be really great sources. We do want to consider, however, the soil quality, how the vegetables were grown, freshness, and of course, we always want to be thinking food first, but supplementation can also be very valuable, especially things like beetroot powder if you cannot consistently eat beets in your diet. We also want to really optimize exercise. As I mentioned earlier, the importance of this on vasodilation and our overall vascular health. So we want to consider things in a progressive manner. So it totally depends where you are personally or where your patient is at this moment. So for example, I always encourage my patients to start with walking. So if they're not doing any other form of activity, this would be the first thing that I would suggest is increasing steps from wherever they are at baseline on average, increasing it 500 to up to 1,000 a day for 1 week before progressing and then increasing it another 500, trying to work towards an ultimate goal of around 10,000 steps a day. That might be more or less depending on you and your overall health and activity. But then we want to incorporate other things. So it's great if you can incorporate some aerobic exercise, but I always, again, want to prioritize. So if you're not walking, I'd say to do that first. And then we can consider activities like walking, jogging, cycling that is going to help with nitric oxide production by increasing blood flow and oxygen demand to the tissues. So strength training is something that I cannot stress enough because that is also going to improve overall health and well-being, as well as influence sarcopenia, overall muscle mass, but it is also going to influence overall circulation, insulin sensitivity, and so many different aspects while boosting nitric oxide production. And then there's also things like yoga and mobility work. And all of these can aid in this perspective, aid in relaxation of the tissues, relaxation of the nervous system. So all of these are going to have an influence on your nitric oxide. We talked a little bit about cortisol. So we want to be thinking of mindfulness and resilience, perhaps somatic practices, but really beginning to recognize if you have chronic stress in your life, if you have low grade stress all of the time. I always say that we can't get rid of stress, but we can absolutely change how we manage it and how we could become more resilient to the day-to-day stressors. And this could look very different for everyone in terms of what that actually looks like, from breathing exercises, because remember, if we're working on breathing, we are influencing that parasynyl pathway for nitric oxide production specifically, but we're also stimulating the vagus nerve. We're creating a relaxation response. We're influencing cortisol levels, bringing ourselves back to that parasympathetic state. Because conversely, when we're in this low grade stress all the time, then we're going to have increased inflammation and increased oxidative stress. It could also look like meditation or gratitude practice. So there's so many different ways that we can begin to incorporate mindfulness in our lives and the patients that we're working to influence ultimately nitric oxide as well as sleep quality. And lastly, I'd love to share a case study of a patient that was experiencing sleep issues as well as nitric oxide issues, so you can really appreciate the correlation. She came to me after seeking out multiple functional medicine practitioners. She's done a tremendous amount of testing, and she still was at a point where she was not feeling her best. That was everything from having oral microbiome issues to chronic insomnia to blood sugar dysregulation. So with her, she had a very complicated dental history, and she had been to different dentists over the years. She's had infections, she's had implants, and again, very, very complicated issue. So one of the things that amidst looking at her timeline, looking at her clinical history and presentation, is that I identified that she absolutely had an airway disorder. So I did an airway screen on her, and I strongly suggested that we either look at her previous sleep study or she potentially get a new sleep study. So she did have a previous sleep study, which showed that in the terms of the doctor that she worked with, was everything looks fine. But unfortunately, it was not fine at all. And I'll get into that in just a moment. And in addition to that, she was having dentists recommend, pretty significant surgeries or procedures, to address the implants and something that was infected and so on. So when we were looking at this full picture, of course, addressing gut health and looking at all of the other inflammatory markers. But one of the things I was really honing in on was the oral microbiome and the sleep and airway. So when we look at our sleep study, we see that she had no significant obstructive sleep apnea, but she snored 0.9% during sleep, and her oxygen saturation was at the lowest at 90%. So now when we think of this in terms of oxygen saturation, if we went to the doctor, we get our O2 tested, and it's 90%, that's actually going to be a pretty big deal. But most of the time, we see sleep studies where everything looks normal, and there is some type of hypopnea, apnea, respiratory distress that is extremely important to address, because again, this is going to have a downstream effect on everything else. So when we look a little bit more closely, we can see that she was having 13.9 events per hour, and she was also dropping from 96 was her O2 at baseline, and it dropped to 90. So again, anytime we are dropping more than 3 points from baseline, that's actually a pretty big deal. So when we looked at her Bristol test for her oral microbiome, then we saw that not only does she have quite a bit of inflammation in the oral microbiome, but she also had extremely low nitric oxide levels. So her score was 1.5 out of 10. And she is somebody that actually is mindful of trying to eat the right things, including beets and including nitrates. So what was interesting was to see the relationship here of how there was a lot of oral microbiome issues in terms of especially inflammation and low nitric oxide levels. There was also some pretty significant sleep issues that have been unaddressed. So we have her on a very detailed, mapped out plan of how to address all of this, from really beginning to address the oral microbiome very specifically, helping to address the inflammation that's happening. We're already working on her gut health as well, because there is a correlation there for her. But simultaneously, she's also working on her airway. So in a temporary appliance right now, and then we'll eventually move into a more sophisticated appliance. She's also planning to have her septum repaired. So all of these things are going to influence each other, which I think is the really important take home that I want you to leave with, is that just as we want to try to improve nitric oxide levels, we also want to try to optimize sleep sleep to influence nitric oxide. So they both are going to go hand in hand. And this is a perfect example of having someone looking at it from all of these different aspects and seeing how they very directly interconnect, I should say, with each other, and how we can make a huge difference on all of it to improve overall health and well-being.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.